Hi, Lisa. It's great to see you. Thank you for taking some time to talk to me today. I really appreciate it.
Of course, I'm really excited to be here.
I know you as the COO of Oxbridge Health, but maybe we can start by you just giving us a little bit of an overview about what Oxbridge Health actually is and sort of a little bit of your history there.
Sure. Oxbridge Health is a new benefits administrator that focuses on delivering a full benefit package with an emphasis on episodes of care. And episodes of care are a different way of both kind of organizing and financing the way that healthcare is delivered. It puts the patient in the middle. It fosters collaboration between all of the care partners that are tending to that patient, and it pays based on results and quality for the overall condition instead of just the typical way that healthcare is financed, kind of widget by widget, test by test.
So that seems a bit different than what I'm used to hearing when I think about health insurance. So, given that we have this healthcare industry and it's really run by these giant corporations, what is it about your team that makes you uniquely qualified to succeed in this kind of space?
Yeah, no, there's several things that I think really uniquely qualify us to succeed in this space. And the first is we have across our management team a very deep industry expertise. Our team is comprised of professionals with extensive experience across the various sectors of healthcare, whether it be insurance itself, clinical or medical practice, healthcare IT, compliance, regulatory affairs, legal, etc. And we really think this comprehensive knowledge base allows us to develop well-rounded and effective solutions. We also are taking an innovative approach. If you talk to other health plans, kind of the big ones out there, they say they're taking innovative approaches, but they're really just kind of honing what they've done for the last 50 to 100 years. We have a history of developing and implementing innovative solutions that challenge those traditional healthcare models. And our expertise in kind of bundled payments, which is how you would finance an episode, and these episode-based benefit plans position us at the forefront of healthcare transformation and disruption. And then we do have a proven track record with our management staff. Collectively, we've had over 150 years of experience in startup healthcare type organizations. And even one level deeper, we've worked together for decades. Our founder, this is my third company with him. Our president, this is my third company with him. And I really think that makes a difference because we know each other's style and we have a very kind of focused way of looking at how we want to transform healthcare.
It sounds like something that's a bit unique, not only in the healthcare insurance space, but just in the startup space to be able to have that experience and that history that you all have with each other is really unique. But I'm wondering, what are the challenges that you need to overcome in this space, given that, it's run by these giants and you're looking at things a bit differently?
The first is market penetration, entering a new market, right? How do we convince the stakeholders, the employers, the brokers who sell to those employers benefit plans? How do we convince them to adopt a new model in a very risk-averse industry, right? So we have to really demonstrate kind of clear, evidence-based benefits of our benefit plans. Another challenge is regulatory compliance, right? We just have to navigate the complex regulatory landscape, which is healthcare. And our team's expertise in regulatory affairs really helps, in my mind, ensure compliance while advocating for the necessary policy changes that we need to continue to challenge as healthcare benefit plan administrators. And then just building trust, right? Establishing it's hard to trust your health plan. We're not really a health plan. We're a benefits administrator, but we are seen as a health plan in a lot of ways. And so we really have to establish trust with clients and our partners. And we're going to achieve this by kind of maintaining a very high degree of transparency and, not just cost transparency, but just transparency in our actions and our intent. and delivering consistent results, and most importantly, prioritizing patient care and data security.
That's great. What other ways do you envision challenging the norms in the healthcare insurance market?
Yep. So the first and foremost is really thinking about delivering care through episode-based care. And what that means is we really want to focusing on patients and their episodes of care, their total condition, really kind of can transform how we organize, finance, buy and sell, insure, measure healthcare, right? And this approach, we really believe, ensures that the patient receives the right care at the right place, at the right cost for them. Another is really challenging the norms, is really using transparent pricing as a way to communicate. There's been a lot of changes in laws that have really forced that transparency from both providers as well as payers, but it's still not 100% there yet. There's not a lot of penalties if payers don't put their costs out there, what their contracted rates are out for consumers to see and view. So there's compliance is an issue, but we want to make that transparent pricing at the forefront. We want to offer, using that transparent pricing, we want to offer guaranteed prices for our episodes, which creates much greater certainty around out-of-pocket costs for employees and making healthcare expenses more predictable and manageable. And then we want to also kind of challenge the norm by customizing incentives, right? Incentives for providers to collaborate with each other, incentives for employers to share if they get savings, share them with their employees, because it's really employees leaning in more to their health plan benefits that are driving those savings. So kind of incentivizing the employee to dig in and lean in a little bit more and have that employer share those savings.
That's great. I mean, it sounds like you're not waiting for the laws to make you be transparent. You're kind of doing that ahead of the game. So I think that's really going to be a great place for you and the company. What else excites you about your product market fit?
What excites me the most is really early validation from all of our stakeholders, brokers, employers, employees about kind of our episode benefit plans and how they are really addressing pain points of all stakeholders, whether it be cost inflation for employees or for employers and for certainty of cost for employees. What am I going to pay with this knee surgery, and you're going to guarantee me a price so I don't get these bills 100 days after my surgery. So this feedback was very positive to us, and it really confirms that we have a very innovative approach and that really meets the needs of the market. And so we're really kind of excited about that, and we will continue to focus on that feedback, even post-launch, but just the early validation that, I get what you're offering. I need to lean in a little bit more and understand my benefits, but what I get out of it is so much more than I'd get out of my current benefit plan.
Yeah, and that probably applies to both the employee and the employer, right? It's kind of across the board.
Yep.
That's great. So product development can oftentimes become myopic, especially in a complicated industry like health insurance, and especially when you're building a new concept like you are at Oxbridge. So can you tell me a little bit about how Oxbridge ensures that its new products will be relatable and usable for its clients?
Sure, yes, and that was really important to us, really important. Our mantra is, it's got to be simple. It just makes sense. It needs to just make sense. So we really focused on that relatability and usability. So we took a very user-centric design, and I use the word user instead of customer because there's a lot of users of our product. The employees use it, their employers use it, and brokers use it, etc. So we involved all of those end users early in the design process to really kind of understand their needs and pain points and make sure that our product offering, our benefit product offering is addressing those. And really use that feedback to influence the design of our benefit plans. We took along the same line, we took a very iterative development approach. We used the agile methodology, and we really that really allowed us to make continuous improvements along the way as we received that feedback. And then we're going to launch pilot programs. We're not going to go out with a national launch. We want to launch pilot programs with selected partners in a selected geographic area, so we can gather those invaluable insights on what's working and what's not working, what key performance indicators are we obtaining, what are we missing before a full-scale launch. So for those three, user-centric design, iterative development, and pilot programs, we think we've kind of encapsulated that relatability and usability, at least for launch. And then we'll do that continuous improvement to our product, and by listening to the users going forward.
And obviously, listening to your users, you're going to be ensuring a great product, but it also means that you're having your sort of hypothesis or your original concepts a bit challenged, because you're putting them in front of people and you want to hear what they have to say. So can you tell me a little bit about how this usability testing improved your product?
Sure. Yeah, it really significantly improved our product by identifying issues, to your point, up front, right? So we could address usability issues. We could, make sure that what we're providing is intuitive. So those usability studies that were done by Sightglass, we really appreciated them, really helped us kind of identify issues early on versus waiting till post-launch when someone really does consume their benefit plans. These usability testing led to the enhancement of key features, right? So making our product more efficient and effective for users, whether it be navigation or content. Increasing, we hope, by doing these usability studies and identifying issues early or enhancing features, that it'll increase adoption rates of our tools, right? So we have a member portal that's very interactive, and we really hope that is used by people, and they don't have to pick up the phone and call all the time. They can use the portal, they can use the chat feature. So really, these usability studies hopefully are going to increase adoption rates of our tools. And then kind of just reducing training time, right? Because we're using these feedback from the usability studies to make our offering more efficient. We're hoping that kind of not only the adoption rate will increase, but the training time for people to use their benefits and use the tools that support their benefits will be decreased. So we're using a lot of videos, point in time videos. Oh, you were going to have a knee surgery. Here, we've got information about that. You watch this short video. So just kind of, reducing that time of how people get up to speed on their benefit plan and how to use it effectively.
Great. It sounds like you were able to gather some insights from the usability testing and apply those, and now you have more confidence in sort of what you're rolling out because you know that people have seen it.
Yeah, I mean, usability testing was really, really crucial in refining our product and ensuring that it meets the mark and delivering value to our clients. I highly recommend usability testing early on in the process because it gives you time to make those iterations and those refinements that will meet the market demand.
Great. You've always been a great partner, and I just really appreciate you taking the time today. And so that'll be a wrap. Thank you for your time.
Thank you.